Hi, I'm Cary Gentry. I'm a colon rectal surgeon with Colon Rectal Specialists here in Richmond, Virginia. And I wanted to just briefly address one of the biggest questions that we receive about bowel preps. That question is, why is my bowel prep not working? And I wanted to address three particular items. The first issue is normal bowel function. Is that most patients have bowel functions once or twice a day. And that is governed by what's called the migratory motor complex, where the bowel function is moved along daily in large waves. And it takes about 24 hours for someone to eat food for that to then become waste and evacuate. That's a normal situation. Some patients, however, do not have normal bowel function and may go once every 3 days, once every 5 days. It doesn't mean there's something wrong with those patients. Some folks have no problems. But the issue is when that is the case on top of a bowel prep, patients may not act as quickly. So I want to reassure those patients who normally have bowel movements once every 3 days, it may take longer for you to do the bowel prep. And in those cases, many times we'll recommend a 2-day prep, where you start 2 days before with clear liquids, and then you prep the day before the procedure as normal. So don't be alarmed if it takes longer, because you take longer. The second thing I want to address about the bowel prep and the question of why is my bowel prep not working is the type of prep that you're doing. There are several types of preps on the market, anywhere from a PEG lavage, like the old standard Go Lightly or New Lightly, to the more current preps which involve smaller volumes. Understand that the bowel preps themselves only work if you follow the instructions, and even still it may take 2, maybe 3 hours for you to start having bowel movements. Sometimes we'll start with Dulcolax tablets or some sort of immediate stimulant followed by the bowel prep, but every patient is different, and so don't worry, the bowel preps will eventually work, but they may take longer. Last thing I wanted to comment on regarding the question about why is my bowel prep not working is the timing of the prep. In that some patients will start their prep in the afternoon at 2 or 3 in the afternoon, some will start it at 5. It depends on the situation. There are preps that require you to take the prep the day before, and some will actually have you take the prep the day up, which is called split dosing. So it depends on the timing. If you take the prep earlier, you're more likely to begin earlier. So if you have a fear that you might not work or might not work for you, then you maybe should start a little bit earlier in the afternoon. If you do split dosing, where you do some the night before, some the morning of, typically those preps are going to be more forceful and more productive the morning of the next day when you do the prep. So, for example, if you have a colonoscopy on Friday afternoon, your Thursday evening prep, you may not go as much, but Friday morning when you take the split dosing prep, that will certainly help you work a lot easier because you've removed a lot of the effluent from the colon. So don't fear, you will go, it will happen, and hopefully this has helped you in preparing for your colonoscopy.